All right. Good evening, everybody. Thanks for joining us, our KSB Community Wellness virtual series. So tonight, the program is on Blood Donation Month. So we have two guests with us today, Janet Jarvis from the American Red Cross and Karen Nelson from our KSB Hospital Lab. So I'll kick it right off to you, Janet, and let you get started the program.
Thanks, Aaron. So it's so nice to be here today, and I want to thank you all. I'm very honored to share with you the importance of donating blood. As Aaron mentioned, January is National Blood Donor Month, so we thank all the active blood donors and who help us save lives every day. The American Red Cross is a humanitarian organization with a rich tradition in the Dixon and surrounding areas. We are very much prominent in our very many different avenues of the Red Cross, from disaster relief to service of the armed forces to international services. But today I'm here to talk to you about the biomedical area. The Red Cross is the only national blood network, and we provide more than 40% of the U.S. blood supply in our country, but we can't do this without you. We collect and process blood through 36 blood regions across the country. We are very thankful to our partners like KSB Hospital, who we rely on to help ensure our nation has a safe and adequate blood supply. The need for blood is constant. There is not a factory that we can place an order for blood products. In fact, our bodies are the factory for blood. With your support, the Red Cross continues to fulfill its life-saving mission. A single donation can save up to 3 lives. The challenge is ongoing as aggressive treatments for diseases, viruses, and an ever-changing and aging population have increased our nation's demand for blood. Currently, we have a dangerously low blood supply. This is a serious situation in our nation. We are experiencing the worst blood shortage in over a decade. Your donation is desperately needed. We need blood donors who have stopped donating blood to please come back, and we're looking always for new blood donors. The solution to this critical need of blood product is for everyone to roll up their sleeves and commit to saving lives. The baby boomer generation was very faithful donors, but as they get older and no longer able to donate, we need to replace these faithful donors with new faithful donors. The donation process is very simple. You make your appointment, you come in, you make sure that you eat a healthy meal and drink plenty of water before your donation. We take a small little mini physical, take your blood pressure, we check your iron and your temperature. You go right into the donation process. The staff will guide you through the process. And then when you're done, you get to eat cookies and have a refreshment. So our current blood status, as I mentioned before, we are in dire need of blood donors. We will be going into an appeal this month, and I would like to encourage all of you to make an appointment for KSB's next blood drive, which is February 15th from 9 to 6 p.m. at the Dixon Elks Lodge on Franklin Grove Road. We encourage appointments, and you can contact Aaron, or you can email myself, or you can go on to the redcrossblood.org and make your own appointment. The number one reason why people have not donated is they've never been asked. So this is my personal ask to you. Please help us save lives and make an appointment today. One donation helps save approximately 3 lives, and we need for you to help us. Thank you.
Thank you, Janet, for your explanation of the donation process. The number and type of blood products transfused at a facility depends on the facility size, the type of patients and physicians at that facility. I'd like to explain how the various blood products are utilized at KSB. One of the most common blood products is red blood cells. Some patients are anemic or have decreased amounts of red blood cells. This can be due to blood loss during surgery or trauma, blood loss after giving birth, cancer, chemotherapy, and many other diseases. Hemoglobin in the red blood cells helps carry oxygen from the lungs to the tissues of the body. If the patient's red blood cell volume is low, they may experience symptoms such as shortness of breath, fatigue, lightheadedness, etc. Transfusion of red blood cells can help replace the patient's red blood cell volume, which in turn increases transportation of oxygen to the patient's tissues. This helps relieve the patient's symptoms. Most patients require transfusion of 1 to 3 units of red blood cells, but at KSB, we have transfused as many as 300 red blood cells units to a single patient. KSB Hospital transfuses an average of approximately 660 red blood cells in a typical year, but we have transfused as many as almost 1,400 red cells in a given year. We stock red blood cells of each ABRH group. The number of the units of each type is dependent on our typical usage, but it also fluctuates according to patient need. Most red blood cells have a life of only 42 days, so it's important that those are replenished constantly. Units with 15 days of life remaining are returned to the Red Cross, and they are replaced with fresh units, so we always have a fresh inventory. Those red units return to the Red Cross then to other facilities that may need them, and this helps prevent wastage of units. Another common blood product is fresh frozen plasma or cryoprecipitate products. These are made from the liquid portion of donated blood, and they contain plasma proteins and clotting factors. These products are frozen shortly after collection to preserve the clotting factors and must be thawed before we can transfuse them. Some patients have a deficiency of clotting factors, or they may be taking an anticoagulant drug such as Coumadin, which reduces the patient's ability to stop bleeding. These patients may experience abnormal bleeding, and they are also at risk of abnormal bleeding during medical procedures. Transfusion of plasma or cryoprecipitate products sometimes is necessary to provide adequate clotting factors to stop abnormal bleeding or prevent bleeding during medical procedures. At KSB, we transfuse an average of 40 plasma or cryoprecipitate products per year. Most patients requiring plasma transfusion typically require 1 to 2 units, but we have transfused as many as 60 plasma units to a single patient. Another necessary blood product is called platelets. Platelets are important in the formation of clots as part of the normal clotting process. Patients may have decreased levels of platelets due to chemotherapy, trauma, large blood loss, and some diseases. Other patients may have normal levels of platelets, but the platelets do not function correctly. This can be due to diseases or medications such as aspirin, Plavix, or Brilinta. Such patients can experience abnormal bleeding and are also at risk of bleeding during medical procedures. Transfusion of platelets provides temporary functional platelets to help stop or prevent abnormal bleeding. Chemotherapy patients may require platelet transfusions every couple of days. Platelets have a life of only 5 days after donation. So there again, it's very important to have a continuous supply of donors. We transfuse an average of 40 platelet units per year. We stock red blood cells, fresh frozen plasma, and platelets in our inventory. We receive a stock order of platelets and red blood cells from the Red Cross 6 days a week, but we can order additional units 24 hours a day, 7 days a week, 365 days a year. Sometimes we need more specialized blood products, such as irradiated or specific antigen negative red cells for patients that have developed atypical antibodies. We can also order these at any time that they're needed. We never know what type or how many blood products will be needed from 1 minute to the next. We try to maintain an adequate inventory to meet most situations. However, recently it has been very difficult at times to maintain the desired inventory levels due to the decrease in blood donations. So I would like to encourage anyone that is able to donate, please do so. Each and every donation counts, and you may be saving a life. So thank you for joining us tonight, and have a good evening.